If you're working in a workplace or at a school or somebody in your own family, what's the best approach? If something happens, for example, what advice do you give others around the situation?
There is a fantastic resource on the website that I'd really encourage people to go and download. So it's a seizure first aid poster. It's just very simple, little A4, print it off, put it up in your tea room, at work, at school,
Great.
any place. And I think even that raises awareness. So the first step, awareness, it's on the wall, people are looking at it. Second step, it's building that understanding and knowledge of how to respond in a moment.
Yes.
So I guess the top things are that we say, if you're present when somebody has a seizure, it's really helpful to time the seizure to observe what's happening, because that's helpful information for the person and their managing practitioner. Mm-hmm. Keep them safe. So if the person's on the ground, putting something soft underneath their head so that they're not hitting that, or if the person's mobile during their seizure, then guiding them away from something that can hurt them.
Yes.
And supporting and reassuring them as they come out of that seizure as well.
Yep. Businesses also to use this resource, and families. So as I said earlier, it's out there, but we really want to grow awareness and encourage people to start using this website, the Epilepsy Smart program.
Yeah, that's right. We've been up and running for a while, but with 250,000 Australians across Australia, we know that we're not reaching everyone who needs these services, and we know everyone's not aware. There's particular communities, Aboriginal Torres Strait Islander communities, who experience twice the diagnosis rate of epilepsy. And we know that we're currently not really reaching those communities. So we've got a couple of fairly innovative pilots happening, one in a remote community in WA and one in Victoria. And we're also working with culturally diverse populations and organisations to find ways to engage and provide culturally appropriate services for them as well.
Right, yes. And that number 1300 761 487, the National Epilepsy Support Service. So let's remind people again about the Epilepsy Smart Australia website. The resources are there. It's education, there's services. It's about connecting through this central point and then sort of moving from there. That's sort of my summary, but let's remind everybody about the Epilepsy Smart program and what it does.
One other important element of the program is support to develop an epilepsy management plan. So if a person does have epilepsy, we do recommend that as one of the key areas to think about and have it documented. Includes things like what might be a trigger for the person, but importantly how to respond while they're having a seizure and then immediately following having that seizure as well. Right. So that plan needs to be accessible wherever that person goes. So if you're in school, at a workplace, the people surrounding you really need to be in a position to know how to respond.
Yes, absolutely. So you can create that plan through the program?
Yes, that's right. Yeah, support to develop both an epilepsy management plan and, if needed, an emergency medication plan. Both of those are developed in collaboration with the managing doctor, but it's the detail and it's the thought process that the team can really support people with, and have that communicated really effectively to all of the different environments that a person is in.
Yes, if you don't have a plan, you'd have to move pretty quickly. That'd be like the first step. I'm thinking, that's something you should do straight away.
That's right, and we often do find in schools the real urgency comes because there's something coming up, or a child has just started in prep, and there's really there's a lot of things that you can't do safely until you've got that plan in place. So sometimes it's a very quick turnaround to get those plans in place.
Yeah. And now that we have this program and it's sort of all central and everything's there, you can do that quick turnaround. It's sort of working a bit better than it did before in a way. It's sort of just in that central point.
Yeah, absolutely. The and the prioritisation of those things. We know how impactful it is. I know I talk a lot about children, but we do work a lot with children and families, and we know how important it is for the inclusion of that child, for the social connection of that child, to just be able to do the stuff that other kids get to do. So we're always searching for those ways of addressing the barriers, and often it's the lack of understanding that creates the sense that no, a child can't do that. And actually it's just about finding the ways to make it safe.
Must be heartbreaking to be, a child or a mum or a dad or a family member, and to have that lack of understanding where the community doesn't get it, and then they're sort of ending up not involved or feeling sort of ostracised.
Yeah, it's really tough on kids and families. Part of the program is about building the capacity of people, including families, the term we use is self-manage. So we're not talking about the medical management of epilepsy, but to advocate for yourself, yes. to be able to have conversations with people and work through, well, what are the actions that need to be in place to minimise some of those risks, to maximise a child's ability to participate. So it's very much a capacity building model.
Yes.
We're not wanting people to... service is always there, but in every step we're wanting to build the capacity of people to feel confident.
Yeah. Well, of course, the medical side is so important, but that's up there as well, the capacity and the awareness. Without that, the other one doesn't sort of work or...
That's right. We know about the demands on the health services as well. Doctors are able to focus on the thing that only they can focus on. And it's really important that they do that part well. But that whole of person management is not typically something that doctors have got a lot of time to be able to spend with people. So we really try and work quite closely and have those referral pathways, we would call them, to make sure that we refer back conversations back to the managing doctor when it's appropriate, but also that doctors are aware of this service as well, so that they can refer people on to us.
All right, well, let's make that change, hey? There's an opportunity now to make that change and grow awareness and think about those young people or everybody who feels, left out because there's a lack of understanding. So together we can change that. And, wouldn't it be great, that we understand epilepsy and not hiding it in the background?
Yeah, first step is always talking about it, I think. So I really encourage people, it's a very personal choice to talk about your own epilepsy, but everybody that I speak to, I always encourage that open conversation, talk about it.
Yeah.
And the more we do, the more that we'll become a community that's aware and responsive to the needs of people living with epilepsy.
Yes, and it might be hard to talk about it, but if you just start maybe just a little bit with somebody you trust and sort of grow from there, it would be tough to sort of just blurt it out, but just feel your way, make a few little baby steps and sort of go from there, but start to talk about it, I think is good advice.
Yes, and we do have some useful resources on the website as well about almost a checklist of things to think through if you're thinking about telling someone that you have epilepsy, particularly in the workplace. So some guidance about what are the things to think through to help you make a really informed decision about that.